Welcome, Dr. Cohen, to a Spotlight series here for the Movement Guild. Appreciate having you here.
Thank you, Adam. It's very good to be on with you.
Thank you. And as you know, this is trying to highlight you as a doctor in our community for the Movement Guild. We're trying to highlight those we work with, and you've done a great job. I think you're a fantastic neurologist. We've
Thank you.
referred both directions. We've referred to you, and you've referred to us. So I just wanted to have you on. And why don't we start, if you don't mind, just tell us a little bit about you and your practice.
Yeah, absolutely. Thank you, Adam. Once again, thank you for being a good colleague and sending us patients and actually taking care of our patients. That's even more important.
It's my pleasure.
Um, so, just a little bit about myself. I'm a solo neurologist working in Chicago for the last 18 years and enjoying the beautiful thing of neurological curiosity that allow me to build out my practice on different things that can or cannot be offered in a bigger practices. And the reason for that is we do not have bureaucracy. It's pretty much if I find something curious or something that research showed very promising, we will do that. So besides the traditional neurology, as you know, that offers evaluation and taking care of patient from different points of view, we offer some other things. One of them was hyperbaric medicine that I looked at about 10 years ago, and we became the first standalone center in Chicago, which is a medical facility. And we're using hospital grade hyperbaric chambers. And the reason for that, we start to use, unfortunately, due to my personal history of my father getting early onset dementia, and I was looking at other things outside of Western medicine that might be helpful. And that's what kind of pushed me over to this more of the investigational approach in neurology. So we did hyperbaric before it became a research published articles for long COVID, and we offer it for patients with long COVID, and we were very successful with that. So moving forward, a couple of years ago, I started to look at a whole thing of neuromodulation. And I think that we both agree that this is a future of the medicine as we kind of hitting the roadblock with pharmaceuticals when they cannot really do much anymore. We start to look at alternatives. And neuromodulation, at least in neurology world, is such alternative. And neuromodulation started with TMS, or transcranial magnetic stimulation, that probably been on the market for about 20 years. It's been finally FDA approved about 10 years ago for depression and obsessive compulsive disorder, but we use it for way more than that. If you think about this, if you stimulate specific area of the brain, you can make that area do something that you want. So for example, if I stimulate speech center, I can allow people post-stroke who are unable to talk to recover their speech faster than those who do not do something like this. If I stimulate motor cortex, I allow them, in conjunction with physical therapy, it will allow them to recover faster, et cetera, et cetera, et cetera. So this is very, very interesting research-based approach which we offer to our patients. And then most recently, we went from central neuromodulation to peripheral neuromodulation with something called MPNS, or magnetic peripheral nerve stimulator. And what that does is stimulating peripheral nervous system for patients with chronic pain or neuropathy. And it's actually was FDA approved, but it has very, very promising research for patients, not just with diabetic neuropathies, but with different type of pain. And here we are in 2026 trying to offer our patients as much as we can. And as you probably remember, we're building a first brain center in Chicago where we will combine all these modalities, including MRI and including hopefully psychotherapy and psychiatry support to our patients under one umbrella of CNS Brain Center.
That's amazing. Tell us a little bit about the patient you work with, because I think there is a wide variety of people that you tend to see.
There is. And, so once again, it's going back to curiosity. I do not think that when you go to medical school that you know exactly what type of patient you're going to be excited about. And frankly, even if you are excited about one type of patient, that might change over time. So for example, I finished my residency and I was neuromuscular guy and I do a lot of EMGs, but over time it's getting repetitive and it's getting boring and it's not really mentally stimulating. So when you know everything what you need to know, so I start to look outside of that, and this is how I came about neuroinflammation and neuromodulation, and this is how I approach my patients. But to tell you what type of patient, you're right. Pretty much almost anything that is related to neurological pathology we can try to help our patients with, ranging from headaches to stroke recovery, multiple sclerosis to Parkinson's disease. And if we are not successful, which does happen, not quite often, but sometimes it does happen, we can always send patients to either Northwestern or Rush University, where I have colleagues who can help patients to, if they need more of the multidisciplinary approach.
That's great. What else do you want us to know about your practice? You just opened up you opened up a new you've been in Oak Park, River Forest, as well as Chicago, but you've opened up a new location there. You want to tell us a little bit about that?
Sure. So I've been in Oak Park. It's actually was my first place when I landed in Chicago, and I've been there since 2007. And it's like everything else, it came to the end with ending our lease there, and we were looking for a place. And so we simply moved from Oak Park to River Forest. It's a new place for us. It's very exciting. I never knew that River Forest is such a beautiful area, to be honest.
Yes.
But it allows us to be more the part of the community instead of being inside the hospital where we do not really see our patients as much. We see them as patients, but not really as community. And over there, we offer our neurological services as well as TMS, or transcranial magnetic stimulation. We have IV infusion suite, which I don't think that I mentioned so far, but we do that for patients with multiple sclerosis as well as patients with dementia for anti-amyloid medications. And we recently, as you probably know, we open physical therapy, where we probably do not offer the same services that you do, but we try to help our patients, those who do not want to travel outside of that geographical area.
No, I get it. That's great. It's your space is beautiful, both of them. I've been to both. And what else do you want us to know about your practice, doctor? One of
We
the things,
open for
yeah,
business.
so one of the things I appreciate about you, I feel like we both like to learn and are continuing to kind of fill in our perceived gaps in our knowledge bases. And so, like in amongst, I've enjoyed my time talking to you, and you do also think out of the box for those listening. So, what are some things that you're interested in more these days? I know you said dementia. You've talked about a number of
So
different
as we both growing older, Adam, I'll be honest with you, I probably have somewhat vested interest in brain longevity,
for real.
especially knowing family history. I do not want to be unpleasantly demented, as my wife claims that I will be. So here we are now, and I'm starting to look at biomarkers of how can we identify patients' problem before they became problems.
Hmm.
So this is one of the biggest holy grail of medicine. How can you identify when patient are more likely to develop problem or not? And lately, what we found out, the specific type of EEG evaluation can allow us to say if patient have TBI or MTBI, or if they're prone to have dementia at the time when they develop mild cognitive impairment. This is my, I don't want to say new venture, but this is my new excitement. This is something that I want to learn more about. I want to see if we can use the so far research-based equipment, if we can use it for our patients and learn from our patients and what they do not have. And pretty much we'll be able to have longitudinal analysis, evaluate apples to apples to see how do they do. And also, in a way, it will allow us to see, do they respond favorably to TMS? Do they respond favorably to hyperbaric medicine? This will allow us to truly have some data-driven analysis for our patient underlying condition.
And that's so important, like particularly around neurology. I feel like some of the people that we probably both see have been to so many different people and get so many different ideas about, different opinions from different for physical therapists or doctors or whatnot. So to be able
Everybody
to,
has an opinion.
yeah, everyone has an opinion, and to be, for I think being able to anchor to objectivity and try to simplify the story as much as possible, I think is really important.
No, I'm with you, because think about this. Our colleagues at internal medicine, they'll measure blood pressure, they'll measure cholesterol, they'll measure diabetes, and unfortunately, that's what they will keep doing. They'll measure numbers and they will follow those numbers.
Right.
We try to find if there's a number that is measurable for our patients with neurological disorders, and can we adjust their therapy based on that number? So
Mm.
stay tuned.
Fascinating. Yeah. I mean, it's fun that we're both sort of thinking about those things. So, what else do you want us to know about your practice before we wrap up here, Doctor?
Well, like once again, we are in two different places, River Forest and Chicago. We are open for business. The one thing that we did not talk about, that it's rather sad reality that patients need to wait for months to be seen. I recently had a patient who had to wait for 6 months to be seen by a specialist out of University of Chicago, and the
Oh,
only reason for that is that those guys are busy.
yeah.
Um, our patients being seen within 2 to 4 weeks.
That's
If
important. That's one of the things, yeah. And like one of the things I like about you and your practice, and there's even been times where, I've said, could you get this person in a little quicker? And you've done a good job with that. And so we,
and we will make that happen because this very old school medicine, when you have the colleagues talking to each other, I think that it's very important. Unfortunately, medicine nowadays is kind of faceless. And it's like we hiding behind the electronic medical records, and at best, maybe there would be a comment in your inbox from your colleague. But that's why I think that we work well together, because we can develop personal relationship, that we can discuss our patients and try to have a plan how we can help them.
I agree. And I think, relating that to, as you know, I'm in school right now. And one of the discussions I was having in one of the classes, we had to do an interview with a chronic person with chronic pain. And one of the things that that person with chronic pain that's been to a lot of people and very educated, smart person is the idea he wishes that there was a case manager almost that was able, because nobody's managing that case from that person that's going from person to person to person. That's part of the dysfunction of our medical system we both find ourselves in. And I guess part of the reason we also like working with each other. So.
I well, yes, and it's like ultimately, I would like to think that we educate our patients enough that they not gonna leave office thinking about that there were some unanswered questions or anything of that sort. And even if they do, we'll try to answer it next time. And sometimes, as you pointed out, we constantly learn something, and I learn from my patients. There's some things that um, I know now that I didn't know when I graduated from medical school or from residency or even 5 years ago.
And just the idea, the ongoing conversation with the patient and kind of being part of their process as opposed to the
Yeah,
end.
absolutely.
Well, sir, I appreciate your time today. Thank you very much. You've got a new website now. What's your new website?
It's cns-center.com.
Excellent. So go ahead and check out Dr. Cohen. Thank you very much for your time today, sir.
Adam, thank you for having me. Always a pleasure.